grappling, of striking, wrestling, where they all meet, what would you kind of put as those like the four key things outside of sleep? Because I think we
Yep.
both know that that
Sleep
supersedes
and
straight to the
diet
top.
obviously are going to
Yep.
be first, right? Sleep and diet are going to be everything that we focus on. But then, you look at recovery tools, and I would say this. If an athlete is doing a lot of grappling and they feel super fatigued and they're just not recovering well, we do a lot of contrast or we do a lot of cold for that. If athletes are more their wounds aren't closing, they're getting infections, staph infections, things like that, I'll put them in a infrared laser
Yep.
bed to help with that because there's good research on a cellular level from that. Um, if they're an athlete that, sometimes active recovery is what does best for them. So we might put them on go for a long walk, go,
Yeah.
along the river or something and do something active or yoga or Pilates or something like that to do more of an active recovery if they mentally need more.
Right.
But I just think, we also, when we get close to them cutting weight, we put them on heat acclimation as a recovery tool, and that's using
Huh.
steam room and sauna because if we can acclimate their body at the end of their days from a recovery standpoint, when we go then to take weight off of them, their body doesn't go, I'm in shock. It goes, oh
Wow.
yeah, we did this every night after I trained and I felt really good and I was recovered. So like, it's really, like you said, specific, but like, yeah, we use contrast, we use cold tubs, we use Normatex. Like if an
Yep.
athlete has done a lot of running, I'll throw them in a Normatec and have their legs elevated
Yep.
because I find that does really well for some recovery. So it kind of is very specific, like you said, depending on if they were grappling, if they were doing a lot of endurance, running, things like that. Were they doing, and sometimes with contrast as well, people will be like, I hate cold. I feel miserable with cold. So I'll just have them finish with warm, right?
Yeah.
Like
Do
you
sauna.
also have to listen to their body. Are they loosening up before doing something? You might finish warm. Is it at the end of the night where you want vasoconstriction because everything has been pumping blood all day and they've had tons of grappling? I might say cold tub it, right?
Yeah.
So
I
it
love
just is.
the palette of options. Like it's so refreshing talking to coaches that are not dogmatic in their approach towards methods of whether it be recovery or training. Like, but just that there is, with each different method, there's a reason. And if you're pursuing the why, you're going to choose the right thing. If you're pursuing the what, then you end up doing something silly that other people are just doing, and that's why you're doing it. And there's not an outcome.